Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Thank you for seeing me on such short notice, Doctor. I've been really concerned about a few things since losing my job, and consequently my insurance coverage. As you might remember, I was a security officer at a hospital, walking extensively every night. But since I'm not working there anymore, I'm worried about keeping up with my health checks and managing my diabetes without the regular resources I had.
Of course, I understand your concerns, especially with the changes in your employment status and insurance. How have you been managing your diabetes medication and general health since your job change?
It's been a bit of a challenge. I've switched to less expensive medication options from Walmart. Thankfully, I can still afford glipizide and metformin, but I keep worrying if these changes might affect my health differently. My main concern lately has been about my blood sugar levels and overall cardiovascular health.
Have you noticed any changes in your health or symptoms since switching medications or since the job change?
Not exactly symptoms, but it's the uncertainty that bothers me. I've been trying to stay active, still walking a lot, although not as much as when I was working. I don't have a blood pressure monitor at home, so I can't check that regularly, which adds to my anxiety. Another thing, since I'm not at the hospital anymore, I don't get those regular TB tests or the usual health checks. I've managed to keep up with my vaccinations though, like the pneumonia and tetanus ones, but I haven't gotten around to the shingles or this year's flu shot yet.
It's good to hear that you've been able to maintain some level of activity and keep up with most of your vaccinations. Keeping active is crucial, especially with your history of diabetes. How about your diet? Have you been able to maintain a healthy diet?
Yes, I've been sticking to a diet rich in healthy fats and proteins. I avoid sugars and excessive carbs. My wife helps a lot with that. She's very supportive.
That's excellent. A supportive home environment makes a big difference. Let's check your recent lab results to see how everything is looking on that front.
I'm particularly curious about those results, especially my cholesterol and blood sugar levels.
Let's take a look. Your fasting blood glucose level is at 110 milligrams per deciliter, which is fairly good. Your hemoglobin A1C is 6.8%, indicating that your diabetes is reasonably well managed. However, your lipid profile shows a total cholesterol of 202 milligrams per deciliter, with an LDL of 130 milligrams and HDL at 45 milligrams per deciliter. Your triglycerides are at 176 mg/dL, which we should keep an eye on.
I see. Are those cholesterol levels too high? I've been really trying to watch what I eat.
They are slightly above the ideal range, especially your LDL and triglycerides. we might need to consider adjustments if these numbers don't improve. Regarding your liver and kidney functions, they are within normal limits, which is good. Your liver enzymes and bilirubin are stable, and your kidney function, with a creatinine of 1.2 milligrams per deciliter and an eGFR of 60 milliliters per min, 1.73 ml squared, is acceptable but requires monitoring.
I'm relieved to hear that there's nothing alarming, but it seems there's still a lot to manage. What would you suggest going forward?
Considering your overall health and the changes in your situation, I recommend continuing with your diet and exercise regime. It's also important to have a follow-up every 3 to 6 months to monitor your diabetes and cardiovascular health closely. Given your past smoking history and age, we should schedule a one-time ultrasound to screen for an abdominal aneurysm. Also, let's plan for you to get the shingles vaccine and the latest seasonal flu shot.
Thank you, doctor. It helps to have a clear plan. I'll schedule those appointments and keep up with the exercise and diet. It's just a lot to keep track of sometimes.
I understand it can be overwhelming, but you're doing a great job managing so far. We'll keep a close watch on everything and adjust as necessary. I'm here to help you through this transition.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I appreciate you taking the time to see me today, doctor. I've been dealing with high blood pressure for a while now, and it's often in the 200s, like today. It's been a challenge managing it, and honestly, I feel more energetic when it's a bit high. I'm not sure why that is.
I understand your concerns. It's important for us to look at your blood pressure trends and symptoms comprehensively. Tell me more about your current symptoms and how you've been managing your health recently.
Well, aside from the high blood pressure, I've noticed my legs swelling up more frequently. I call it swellness because it comes and goes. I've been using Nopala, which is a natural remedy from cactus, to help with the swelling. I'm trying to stick to natural products as much as I can.
I see. And how about your diet and other activities? Are there any changes or stress factors that might be affecting your blood pressure?
I've been babysitting my grandkids every day, which can be quite stressful. However, I use marijuana occasionally to manage that stress. I also garden a lot, which helps me relax. As for my diet, I take various supplements like green tea extract, krill oil, and vitamins B12, B6, D3, and MSM. I've heard these are good for managing blood pressure and other health issues. Regarding medications, I'm currently on aspirin and Plavix daily. I've heard good things about Plavix preventing chest pain, and I prefer red yeast rice over other cholesterol medications because it's natural. I had some bad experiences with prescribed drugs in the past, which made me turn to natural remedies.
It's good to hear you're actively managing your health. Let's discuss your past medical issues a bit more. You mentioned adverse reactions to medications.
Yes, doctor. In the past, I've tried several medications for different conditions, but I often faced adverse reactions or found them ineffective. This has led me to be cautious about new prescriptions and rely more on what I've experienced personally or learned from alternative health sources. Also, I had valve replacement surgery some years back, and managing my heart condition has been a major part of my health focus. That's another reason I'm keen on using supplements and natural remedies. I feel they are safer for me.
Understood. Your preference for natural over prescribed medications is clear. Let's go through some of your clinical findings from today and your recent tests to see how we can best address your health concerns. Your blood pressure today was initially 220/110 millimeter, which is quite high, and it decreased to 205/100 millimeters after some rest. Your heart rate is stable at 88 BPM, and other vitals like respiratory rate and body temperature are within normal limits. Your weight and BMI indicate that you're slightly overweight, which can impact blood pressure management. Looking at your lab results, your kidney and liver functions are normal, which is good. However, your cholesterol levels are on the higher side, with LDL at 140 milligrams per deciliter and total cholesterol at 215 milligrams per deciliter. It's important to manage these levels to reduce the risk of heart disease, especially with your history of heart valve replacement. Your echocardiogram showed mild left ventricular hypertrophy, which is a thickening of the heart muscle often seen in long-term high blood pressure. There's no peripheral arterial disease as per your recent vascular ultrasound, which is positive. Based on these findings, it's crucial to manage your blood pressure more effectively to prevent further heart complications. We also need to keep an eye on your cholesterol and general cardiovascular health. As for the plan, I recommend a follow-up appointment in 2 weeks to monitor your blood pressure and adjust your treatment as necessary. I understand your preference for natural remedies, but we need to find a balance that safely manages your conditions. I'll also refer you to a dietitian to discuss dietary approaches that could benefit your blood pressure and cholesterol levels.
Thank you, doctor. I appreciate your thorough review and understanding of my preferences. I'll consider your suggestions and continue monitoring my health closely. I'm looking forward to our next appointment to discuss how things are progressing.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Based on your recent diagnosis of chronic hepatitis B, I recommend starting antiviral therapy. This can help control the virus and prevent liver damage.
What exactly does antiviral therapy involve, and are there side effects?
The treatment often includes drugs like tenofovir or entecavir. These medications can significantly slow down the virus, reducing your liver inflammation and lowering your risk of liver disease. Side effects can vary, but might include nausea or fatigue.
How long will I need to take these medications?
This treatment is generally long-term, possibly lifelong. We'll monitor your liver function and viral load regularly to adjust the treatment as needed.
Will these medications cure my hepatitis?
These drugs won't cure hepatitis B, but they are very effective at managing the disease and preventing serious complications like cirrhosis or liver cancer.
Now look at question 26.
It's completely normal to feel overwhelmed after a diagnosis. Let's discuss some coping strategies that might help you manage these feelings.
I'm all ears. I've been quite stressed and unsure about how to deal with everything.
First, staying informed about your condition can really help. Knowledge can make you feel more in control. Additionally, maintaining a healthy lifestyle, including proper diet and exercise, can improve your overall well-being.
What about handling stress?
For managing stress, you might consider activities like yoga or meditation. Techniques like these are proven very effective. Also, don't hesitate to seek support from friends, family, or support groups. Sometimes talking things out can make a huge difference.
Now look at question 27.
Empathy is crucial in healthcare. It's about more than just treating symptoms. It's about understanding and responding to the emotional experiences of our patients.
Absolutely. I've noticed when I acknowledge a patient's fears and concerns, they often become more receptive to discussing their health and following treatment plans.
Exactly, and it's important to actively listen and give patients space to express themselves. This can lead to better patient outcomes and satisfaction.
Now look at question 28.
Let's focus on ensuring that every patient feels heard and validated in their treatment plan. It's essential for patient-centered care.
I agree. Validation should start with understanding the patient's perspective and concerns. It helps in building trust and effectively managing their care.
Indeed, each team member plays a role in this, from doctors and nurses to support staff. Making sure the patient's voice is at the center of our care strategy is key.
Now look at question 29.
Home safety modifications can greatly benefit patients, especially those with mobility issues. Things like grab bars and improved lighting can prevent falls.
I see the benefits, but one challenge is that patients often resist changes in their homes. They see it as an acknowledgement of their declining independence.
That's a valid point. It's about presenting these modifications not as a loss of independence, but as tools to enhance their independence and safety at home.
Now look at question 30.
Taking your oral anti-diabetic medications consistently is key to managing your diabetes effectively. Each type works differently, so it's important to take them exactly as prescribed.
What should I do if I experience side effects?
If you notice any side effects, don't stop taking your medication, but do contact your healthcare provider. There might be alternatives or adjustments to your treatment plan that can help.
How will I know if the medication is working?
We'll monitor your blood sugar levels regularly to ensure the medication is effective and adjust the dose if necessary. It's also helpful to keep track of your levels at home.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today we delve into the intricate relationship between geriatric syndromes and the management of acute coronary syndromes, ACS, in the older adult population, a topic that is increasingly critical as our global population ages. The management of ACS in older adults presents unique challenges, particularly due to the prevalence of multimorbidity and the physiological changes associated with aging. Let's explore these complexities through a detailed case study that highlights practical approaches and the latest insights from the American Heart Association. Our patient, Mr. Smith, is an 82-year-old male with a history of hypertension, type 2 diabetes, chronic kidney disease, and previous myocardial infarction. He presents to the emergency department with acute onset chest pain, characterized as severe and radiating to his left arm, associated with shortness of breath and nausea. Given his age and complex medical history, his presentation of ACS is not straightforward. Initial ECG shows non-ST elevation, and his troponins are elevated, consistent with a non-ST elevation myocardial infarction. However, considering his age, the diagnostic process extends beyond simply confirming NST-MI. Older adults, like Mr. Smith, often present atypically and may have other conditions that mimic or mask the symptoms of ACS, necessitating a thorough and cautious approach. Management begins with the stabilization of Mr. Smith's cardiovascular status, adhering to the American Heart Association's guidelines for managing ACS in older adults. These guidelines emphasize the importance of a tailored approach that considers the patient's existing comorbidities and overall functional status. In Mr. Smith's case, his multimorbidity includes considerations for kidney function and diabetes management, impacting both the choice of medications and the invasive procedures considered. Invasive strategies, such as percutaneous coronary intervention, PCI, are recommended for certain cases of NSDME in older adults, particularly when symptoms are severe and there is evidence of ongoing ischemia. However, the decision to proceed with PCI involves assessing the risks of the procedure against the potential benefits, especially given Mr. Smith's frailty and the likelihood of procedural complications. His care team opts for a conservative management strategy initially, focusing on medication adjustment and close monitoring. Pharmacological management in older adults like Mr. Smith must be meticulously managed to avoid polypharmacy and adverse drug interactions, a common complication in the geriatric population. The choice of antiplatelets, the mainstay in ACS management, is influenced by his risk of bleeding and his renal function. A newer generation antiplatelet agent with a lower bleeding risk is preferred, and his other medications, including those for diabetes and hypertension, are adjusted to optimize his overall care. Considering his frailty, a comprehensive geriatric assessment is crucial. This assessment helps in planning both the acute management of his ACS and his longer-term care needs. Rehabilitation, crucial for improving outcomes after ACS, needs to be tailored to accommodate his physical and cognitive limitations. Education on lifestyle modifications and medication adherence is also vital. Given the complexity of his medication regimen, Mr. Smith and his family are provided with detailed counseling on the purpose and proper use of each medication, potential side effects, and the importance of adherence to prevent further cardiac events. The case of Mr. Smith illustrates the challenges and complexities of managing ACS in older adults. It underscores the necessity of an integrated care approach that combines cardiology, geriatrics, and primary care to address the unique needs of this population effectively. This holistic approach not only addresses the immediate clinical needs, but also the broader aspects of health, such as functional status, cognitive health, and quality of life. Managing ACS in older adults is a multifaceted challenge that requires a deep understanding of the physiological and clinical nuances presented by aging. The case of Mr. Smith highlights the importance of guidelines tailored to the geriatric population, advocating for a balance between aggressive management and the preservation of quality of life. The collaborative efforts of the multidisciplinary team in adjusting the treatment plans according to the individual patient's needs are crucial in providing optimal care for older adults with ACS.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Culinary medicine, a burgeoning field at the intersection of nutrition science, culinary arts, and clinical practice, is rapidly gaining recognition as a pivotal component in managing chronic diseases. This innovative approach not only emphasizes the importance of nutrient-dense, culturally relevant foods in disease management, but also seeks to empower healthcare professionals and patients with practical cooking skills and nutritional knowledge. In this discussion, we delve into the role of culinary medicine in chronic disease management through a detailed case study. We are introduced to Michael, a 52-year-old patient diagnosed with type 2 diabetes and hypertension. His medical history is complicated by obesity and a recent diagnosis of non-alcoholic fatty liver disease, NFLD. Michael's dietary habits, characterized by high sodium and processed foods, have exacerbated his condition. Despite numerous consultations, traditional dietary advice has had limited impact, leading his healthcare provider to consider a more integrated approach. Given Michael's challenges, his physician referred him to a culinary medicine program, which is designed to bridge the gap between his clinical treatment and daily nutritional practices. The first step involved a comprehensive dietary assessment conducted by a registered dietitian, followed by enrollment in a series of culinary medicine workshops. During these workshops, Michael learned about the impact of his dietary choices on his health conditions. The sessions were hands-on, focusing on preparing meals that were both appetizing and appropriate for his medical conditions. For example, one session taught him how to make a heart-healthy mackerel salad, rich in omega-3 fatty acids, which are beneficial for heart health and managing NFLD. What makes this approach effective is its practical application. Michael not only learned about the nutritional content of foods, but also mastered skills like choosing healthier fats and lean proteins, reading nutrition labels, and managing portion sizes. These skills are crucial for sustaining dietary changes in the long run. The culinary medicine program addresses several barriers to effective dietary management in chronic disease. First, by integrating culinary skills with medical knowledge, patients can make informed food choices and feel empowered to take control of their health. This empowerment is essential for long-term adherence to dietary recommendations. Moreover, culinary medicine emphasizes the cultural relevance of food, which is vital for acceptance and sustainability of dietary changes. In Michael's case, incorporating familiar foods in healthier ways helped him transition more smoothly to a healthier eating pattern without feeling deprived. After 6 months in the culinary medicine program, Michael showed significant improvements. His HbA1c levels decreased from 8.5% to 7.1%, indicating better managed diabetes. His blood pressure also stabilized, and he reported feeling more energetic and less dependent on medications for blood sugar management. This case study not only highlights the effectiveness of culinary medicine, but also underscores the need for its broader integration into healthcare practices to address the complex and growing burden of chronic diseases. These improvements are not just clinical. Michael's enhanced understanding and skills have led to sustained dietary changes, which are likely to contribute to long-term disease management and improved quality of life. His case is a testament to the potential of culinary medicine to transform patient outcomes through education and practical skills development. Culinary medicine is more than just a novel approach. It is a necessary evolution in the treatment of chronic diseases. By focusing on food as a core element of treatment, healthcare providers can offer more holistic and sustainable solutions to patients like Michael. For healthcare systems and providers looking to incorporate culinary medicine into their practice, it's important to develop structured programs that offer both theoretical knowledge and practical cooking skills. Collaborations with dietitians, chefs, and culinary professionals can enhance these programs, making them a powerful tool in chronic disease management.